Hi, I am Dr. Hirennappa, pulmonologist practicing at Inspire Specialty Clinic at Sakarnagar. Normally, the chest X-ray and PFT are good enough to diagnose a COPD if there is abnormal lung function with compatible history, smoking history, and there are a risk factor. Sometimes in a non-smokers, the risk factor might be air pollution, which is the biggest risk factors now in urban areas where we are exposed to high amount of pollutants. And sometimes in females it is biogas that are risk factors. If a proper risk factors are there and a history of COPD with whatever symptoms we have said and X-ray showing there is no other alternative diagnosis in India, one of the things is tuberculosis and pneumonia or chronic infections. If you rule that out and PFT confirms it and it is COPD, that's the way we diagnose COPD. We rarely require a CT scan of the chest to diagnose COPD, and sometimes there are associated ILDs are there, that time we require a COT, or if there is a bulla we require a CT scan, and echo, ECG if there are changes of right heart load, if it is a progressive disease of COPD it might be required. Normally PFT and X-ray are enough to diagnose COPD. So we will, once we diagnose the case, the treatment for COPD is usually the bronchodilators. Now there are long-acting bronchodilators and ultra-long-acting bronchodilators, and if it is very severe, we add inhaled corticosteroids with long-acting bronchodilator and long-acting anti-muscarinic drugs in a stable COPD in terms of treatment. But sometimes if there is advanced disease, they may require a long-term home oxygen therapy. They are hampered by recurrent exacerbations. We have to just see preventive steps in terms of vaccination. Usually it's pneumococcal. We have two types of vaccine. One is a lifelong protection, what we called as non-polysaccharide vaccines, and another's are once in 5 years we have a polysaccharide pneumococcal vaccine, because 50% of the pneumonias are due to streptococcus pneumonia. And yearly during the start of a season we give influenza vaccination as a part of a preventive things in COPD. These are about preventive aspects of infections to prevent the future exacerbations in COPD. If it is a chronic disease, sometimes they require home ventilations and it is really mutilating diseases and they are hampered by infections and all. The biggest thing which is preventive, which can really change the course of the disease, is smoking cessation. We can run a quit smoking clinics and we can help them to quit. There are certain drugs available with like a nicotine gums and transdermal nicotine patches, and there are drugs to quit also, like varenicline, tartarate, which is a partial agonist. We have 6 weeks course and they have a clinical psychologist who can really have in a helpline. They just help you in quitting, and certain anti-depressants are also used in quitting the smoke. These are things. Other things is to prevention in terms of air pollution. So this is also a biggest risk factor. 90% of the COPDs are smokers and 10% may be non-smoker. Even the previous TB history can be a COPD later, and because that is a risk factor. And childhood infections, sometimes asthma is a risk factors, and recurrent infections can be a risk factors. Because of the air pollution, those are the things we should prevent in urban areas, because along with the smoke and exposure to a smoking also, it can be additive and synergistic action. So the prevention, wearing the masks in terms to preventing the air pollutions and prevent the oxidant, antioxidant damage, because most of our time is spent in outdoors. Outdoor air pollution is the biggest risk factors for COPD also. And even the second-hand smoke in child, they can be prone to infections to the children in the family also. So these are the preventive aspects. Usually it is smoking cessation, vaccination, and prevention to the exposure of the biogas, smoke, and air pollutants.